So now we're going to talk about specific concerns for parents of kids with spina bifida. And for this section, I asked a couple moms of my patients to reach out to other moms and ask what things are most concerning to you right now during COVID-19 so we can talk about them. So the first thing that came up is infection concerns, right? Our kids are already at risk, higher risk for having complications if they get sick. And so what are some things we can do? Really wash your hands, super easy, but it's the best way to keep yourself healthy. Using soap and water, 20 seconds, the whole thing that I know you've heard 1,000 times, just don't forget it. You can use hand sanitizer that has at least 70% alcohol. If your kiddo is in a manual wheelchair, make sure that you are frequently wiping down wheels, push rims, brake handles, push handles, any part of the chair that hands are touching, essentially. And then one other thing that actually came out during another webinar is the importance of hand washing and good hygiene before and after bladder or bowel management. So before capping or ACE flushes or cone enemas, whatever it is that your child uses, this is extremely important to make sure that you are washing hands and doing all of that. There is some suggestion that COVID-19 could potentially be spread in urine and feces. And so again, another reason to really look at the hygiene. Another concern is having difficulty obtaining your regular DME supplies, right? They come on a monthly basis, and you're worried that maybe the company that you're working with isn't able to get your catheters or your diapers or whatever it is. So kind of a few things to think about. Plan ahead, kind of a little hard now because we're in it, right? But I know that there are a lot of families who end up with a closet full of catheters because they were getting more than they were using every month and they were just kind of hanging on to them. So again, if that is happening to you, hopefully you've planned ahead or talked to friends who have planned ahead and could help. Another option is to call the office of the prescribing physician. So like in our clinic in urology, our physicians sign all the DME orders. You could call me and I could go to our closet and say, oh, I do have, a 12 French. It's not the same brand that you typically use, but I have these and you're welcome to either come and get them from the clinic or I can mail them to you, whatever that is. Check with your local Spina Bifida Association chapter. And again, I'm sorry, I don't know what everyone else is doing. As part of the Spina Bifida Association of North Texas, I can tell you that there is a closet, and by closet, it's a huge room actually, that is full of any DME supply you could think of, any size catheter, any shape. It's incredible how much stuff is in there. So check with your chapter and see if they have something like that. And that's a place that a lot of our families go if they don't have insurance coverage or they're having to pay out of pocket for these kinds of things. So kind of separate from COVID, if you fall into that category, you could potentially ask too. Check with local Spina Bifida parent groups. Again, if you're in those kind of parent groups on Facebook or Yahoo, wherever it is, even sending out a message and saying, hey, I'm running really low on 10 French straight catheters. And there might be another parent who says, well, great, because I have an entire box of them because we moved from 10 to 12 and we still got the 10. So work with each other. The last option, and again, this is kind of a last resort. I'm not suggesting that everybody start changing companies. But if you cannot get your supplies and you've tried all of these other things, one option is to consider changing DME companies. So several of the larger companies have assurances in place that they won't have difficulty continuing to fill orders. So just keep that in the back of your head. And again, final option, because in order for this to happen too, you also are going to need a new prescription from your physician. New forms have to be filled out for insurance. So it's not nearly as easy as just picking up the phone and saying, hey, I want to switch to whatever company it is. But keep it in mind. Concerns about missed doctor's appointments. And this is a really hard one because if your, kiddos clinics are anything like our clinics, we are scheduling months out, right? And so trying to figure out how those missed appointments are going to fit into a schedule that is already full of appointments. Look, we're in it with you, and I wish I had an answer for you. So a few things that I would recommend. If you have a patient portal, you can utilize that to send messages directly to your physicians or to their nurses or whatever it is, right? You can contact the doctor's office directly and ask them, hey, what are your plans for rescheduling? What is the policy? I just want to have a plan in place, because just having a plan will reduce some of that anxiety for you or that uncertainty. Thinking about things like yearly follow-up appointments. Oh, every summer we do urodynamics and renal ultrasound, renal function panel, and see our urologist. It's just what we do, right? And then we see the neurosurgeon and all of that. I wouldn't stress too much about that. If your kiddo is doing really well and is on, their yearly follow-ups, then you probably are one of those people that could maybe wait. So instead of coming in July, maybe you come in September this year, right? I'm certainly not saying don't do your yearly follow-ups, but just think about being a little bit more flexible, and then think about those other patients who have more urgent issues and that they need to kind of get into those earlier spots. Urgent issues absolutely still need to be addressed. You need to contact your child's doctor if you're concerned. Keep track of your questions and concerns, whether it's on your phone, on a piece of paper, so that when you do see your child's physician, you can ask those questions. And then consider telemedicine appointments if physical exams are not needed. And I know in our clinic right now, we're doing a lot of telemed appointments. And so that's a way that, face-to-face with your physician or nurse practitioner, physician assistant, whoever that person is, but just to at least be able to see them and get some feedback. And then concerns about missed therapy appointments. And this is a really hard one, and honestly, the one that I had kind of the most difficulty coming up with some answers for you too. So the first thing would be consider practicing the homework that your therapists have given you throughout your child's therapy, right? So go home and practice, in our house, it was all these little pieces that start with S, all these words that start with S, and put them in a silly sentence, and you have to say that. So we're working on articulation. So things like that, continue doing that. Consider utilizing a second adult or an older child to help. One of the things that can be really stressful is if you are the primary caregiver and you're trying to do therapy, because your kiddo, if he or she gets frustrated during therapy, then they take it out on you, and then that kind of affects how the rest of the day goes. And so if you have a second adult in the home, or somebody that you're quarantining with, or physically with, ask them to help with some of that. Or if you have an older child that's able to help your younger one, ask them to do that too. And that's a really good tip, actually, completely unrelated to COVID-19. When you think about homework, this is a point where there can be a lot of contention about homework once school gets back into session. And if you can have somebody else help with that, whether it's a tutor, a high school student, somebody else, it changes the relationship between you and your child. And it kind of, you still get to be the safe person, not the person who's yelling and screaming about doing their homework, right? You can reach out to your child's therapist and ask for specific recommendations. Again, if your therapist is through a facility, you might be able to reach them through the portal. And then you can look online for other activity ideas. So maybe, and I put outside, like getting outside, doing something outside, a change of scenery, like we talked about, be creative with your workspace, be creative with your kids too. I mean, oftentimes they can go, sit on the grass or sit on a blanket on the grass and still work on stacking their blocks or putting their cups together, whatever skill they're working on. So I have some resources to share with y'all. First, a few take-home messages. Okay, parenting is hard. Pandemics are hard. Parenting during a pandemic is exponentially hard. You're doing a great job, even if it doesn't feel that way. Set realistic expectations at the start of the day. And honestly, if that expectation is my child is going to eat at least twice today, we're not saying which child's eating, but they're going to eat breakfast and lunch, and they eat cake for breakfast and ice cream for lunch. At the end of the day, they did, you met your goal. You met your goal for the day. So give yourself some grace, come up with those realistic expectations. Ask for help if you need it. We've kind of talked about this. There are crisis lines on the next slide, but call friends, ask family. And even if that's like, hey, can you distract my kiddo on FaceTime while I go cry for a couple minutes? Like, those things happen. Consider changes to anxiety and or depression medications. If you're already on these medications or have a history of using these medications, this could be a good time to get back in touch with your physician and say, hey, I'm super stressed. What do you think? Could we change? Could we go up on this medicine a little bit? Or if you've previously been on meds and are not on meds, but feel like, hey, I feel like I need to go back. Or if you've never been on meds and you're also saying, I've never felt this way and I can't shake these feelings and I need help, call your primary care physician. Or your OBGYN, depending on how long it's been since you delivered a baby, because OBGYNs actually write more prescriptions for antidepressants than any other group, which kind of makes sense. But don't be afraid to ask for help. If your brain needs those extra chemicals, it needs those extra chemicals. I'm in a phenomenal mom group. I'm here in North Texas. And last week, somebody said, okay, y'all, let's do quarantine confessions because I feel like I am failing. And so these are just a few of, there were over 1,000 comments by the end of the day, but so just a few. So one mom said, as it turns out, not enough time was not the reason why I never worked out. Another mom said, I take conference calls in my car to give myself a timeout from the noise. One said, I'm a lawyer and I had a meeting over Zoom this morning. So I curled the front of my hair, but not the back because no one sees it. I didn't put on makeup because Zoom has a softening filter actually that you can use. I wore a nice shirt with pajama bottoms and slippers. Just keeping it real over here. And the fourth one was, I put Alexa in my 3-year-old's room and the kids yelled at it and danced for an hour yesterday. It was the best idea I've had so far. So we are all struggling. We are all making it work as best we can. We all feel like we failed at some point, probably every day. But again, remember, don't be so hard on yourself. If your best friend was feeling the way you're feeling, what would you say to him or her? And say that to yourself. Be kind to yourself. Remember, we are in this together. This will be posted on the Spina Bifida Association's website. And again, more resources, and thanks so much. Take care. Have a great day.